Hey Trish, how are you?
I am great. I love your hair.
Thank you so much.
It's so long since I've seen you.
It's really gotten long.
Well,
Um, but I'm letting it grow out a little bit, so
it looks good.
thank you so much. I was gonna actually type up what we said yesterday and put it on the screen, and I thought, well, I won't.
Oh,
And Brad, huh?
you could have.
Well, I just thought we may have to restate the questions, which is fine. And then Brad said, we have a local areas managers meeting today, and so he's not going to be on today. So he said, he told Jeff, the director, that he would get the information from me, which is good. That means I should take notes.
Well, and you can speak freely.
Yeah, yeah. And he has the same, views, very similar to me. So,
That's good.
yeah,
That helps tremendously whenever you can do that.
for sure.
I've got my KH.
What'd you say?
I'm right. I'm getting my meeting notes ready too.
Oh, I didn't see a whole lot of people originally invited to this, so I don't know if it was designees weren't.
I don't know. Or maybe not that many directors responded to him as to who would he
Oh,
may have.
that's possible too, yeah. Just seems like we probably have more programs than
Yeah.
what's listed here.
Okay. I'm gonna look.
Oh, we have. I like that people can just get on.
Me
Good
too.
morning.
Good morning.
I got on about 15 minutes early and I was like, I figured John may be on here and he wasn't. And it started recording as soon as that. And I thought, well, maybe the first part they'll just
Yeah.
just drinking my coffee. Nothing earth shattering that happened in the first 15 minutes. So,
Oh, there really isn't very many people.
well, it looks like less than 20 maybe. I mean, I didn't count the names, but
We've got Paducah Head Start. Several from Paducah Head Start. 3.
yeah, I'm interested in seeing, we have our data team meeting next week. I'm interested in seeing if Brad thinks that, our other 2 data people, we actually have 4 other, but 2 of them would be my position just on the other 2 teams. So,
Yeah. Yeah, I would have thought John would be here so that we would.
yeah, meet expectations.
Yeah, well, or know what the results of the survey were.
Oh, that's true. Oh, for sure. Yeah, I did think about that. We'll just remind everyone to make sure that they complete that. And
Yeah.
I don't mind to email John and include you in on the,
Okay.
okay.
That would be great.
He may pop on here like you said, but. Come here. Hang on a second. Let me mute.
Okay. Good morning, everybody. We will get started in just a minute.
All right, can you hear me now?
Yes.
All right, hooray. Wonderful. All right, we've got a few folks on here. We'll give it another few minutes. How is everyone on this lovely Thursday morning?
Wonderful. It's
wonderful. I got a smile
Friday
on my
Eve.
face. Yeah, I cannot believe it is already the middle of October.
I was talking about that earlier with
Yeah.
someone else.
That snuck up on me.
John, you're on the call and I was finishing my note to email you and I was like, I wonder who's talking. And I looked up and it was you, so I can cash that.
Yeah, mark that one out. All right, let me get a few things opened here while people are joining.
Trish, is that a chalkboard behind you?
Yes, ma'am, it is. I come up to Murray I have another training to do today. So I'm in a West Conference room, which is an old
Okay.
classroom. And I have a chalkboard, and it really works if you have chalk.
You just don't see that. And I was like, I don't believe that's her background.
Our board office is an old elementary school.
Mhm.
And so the rooms are classrooms.
It's actually kind of neat.
It is. We've got retro going on here. Or
So
Yeah.
it's just a couple of minutes after 10, and I have pledged to make sure that each one of these sessions only goes for about an hour. So I want to be respectful of everyone's time. I know everyone is particularly busy right now. We've had a series of really good conversations over the last several days with many of our different sections. I have already met with, I'm going to pull up my notes here. I've met with the Disabilities and Mental Health group. I've met with the Health and Nutrition group, and I have met with the Family Services group. So today I'm meeting with Data and Technology, and tomorrow meeting with Education. So we are off to the races, as they say, especially given that Keeneland is running up here. So we are definitely off to the races. Really good conversations, and I think some really good themes that continue to, I think, sort of cross over each of these areas. Each of them have identified a lot of good goals and objectives and issues that are relevant to their particular areas. But there are several themes that are sort of crossing over. And so we will get to those as we work our way sort of through our issues with the Data and Technology group. So with that, why don't I ask, let's start up in the top corner as I see it on my screen with Stacy, and let's just go around and ask everyone to introduce themselves. Tell us who you are, who you're with, what you do, and how long you've been with Head Start.
Okay, I'm Stacy Royalty. I am one of the co-chairs of the committee. I am the information system specialist, primarily for the education team. I've done education for the entire program, and we've broken off into teams to try to zero in on data. I've been here for 14 years, and I'm a part of the data team that runs Audubon. It's the data group.
Very good. All right, Wes.
I'm Jennifer.
I'm sorry.
I'm Jennifer. That's okay. I'm Jennifer Stillman. I'm with the Carroll County Child Development Center. I've been with Head Start since January of 1994. My current position with Carrollton is office manager, but I've done a little bit of everything. I spent 22 and a half years in Trimble, and I've been with Carroll the last 5.
Very good. Okay, Wes.
Hello, everybody. My name is Wes Burkhead. I'm with Bluegrass Community Action Partnership. We do the Bluegrass Head Start program. I've been with our organization for roughly about 13 years. I serve as our Senior Director of IT Services. So while I'm not in and out of the classroom or the Head Start Center every day, I'm kind of helping ensure that networks are there for classrooms and for staff, and just kind of handling that whole technology side of things.
All right, thank you. Trish?
Hi, I'm Trish Pickett, and I'm with the Murray Head Start program. My current role is Data and Technologies Service Manager, and I have been with Head Start for, oh my goodness, since 1993, so about 28 years. I have been in family services. I've just kind of been a lot like Miss Spillman and all over the place, but I've been in class, I've been in centers, and so it's a wonderful experience. And I'm
Martina?
also one of the co-chairs. I'm sorry.
All right, Martina.
You're muted, Martina.
You're still muted.
Oh, sorry.
There you
Can
go.
you hear me now? All right, I'm Martina Rowe. I'm the Director of Early Childhood for Gateway Community Action Head Start and Early Head Start programs. I've been with the organization for over 20 years, and I've been serving as the director for the past 7 years.
All right, David.
Morning, everybody. My name is David Serrano. I am part of the Greater Louisville Head Start grant. And I've been in Head Start overall for around 15 years.
And Justin.
Justin Collar. I'm the Assistant Head Start Director of LKLP Head Start. I've been with Head Start. This is my 7th year, and I work with data in various areas of our program.
Very good. Okay, so our goal today really is to just talk about what this new section is and to review, I think, the responses that we had to the 3 questions that were sent out to everyone. And we had a variety of responses, different levels of responding for each of our different groups. But those questions really were, what did you see as the top 3 issues facing children and families when it comes to data and technology? The second question is, what do you see as the top 3 challenges facing staff when it comes to the use of data and technology? And that could be sort of program wide as well. And the third question was, if you could wave your magic wand, regardless of time, staffing, or money, what would be the one thing that you would fix in terms of data and technology for Head Start? So those really were the 3 questions. And so we've asked very similar questions of each of our different sections. And so if it's okay with Stacy and Trish, I'm going to share my screen and pull up those responses. And I'm going to paste them. Let me paste a link in the chat real quick for those of you. I think everybody got a copy of this in advance, but I'm going to paste it here so you guys can open up those materials if you so choose. Okay, so, well, before we do that, we probably should take a look at who we are and what we're supposed to be doing, right? So we've got sort of these descriptions of each of our sections that we've come up with. And data and technology, our goal is to focus on the availability, collection, use, and dissemination of Head Start data and how data may be employed to enhance Head Start services. And we're to focus on the use of technology to create new opportunities for Head Start programs to become better at providing efficient and effective services for children and families. So sort of a broad catch-all if we think about data and technology and how it's applied across Head Start. So we only had a few responses, not many responses here. So I'm hopeful that our conversation this morning is going to allow some additional issues to emerge. But those issues that were recognized were when it comes to issues facing children and families, access to internet, reliable internet, and having access to equipment. I think if we look at the themes here across those responses, those are going to be the primary ones. Now, when we look at the next question, which is what, in your opinion, are the top 3 challenges facing staff? Security awareness training, training of how to use software and hardware adequately, and then handling client data safely. So our first question really revolved around access. And this question really seems to revolve around the use of the data and the training for staff. And then the final question that we had, excuse me, if you could wave that magic wand, security awareness and making sure data is protected at all times. So we've got a little bit to do, I think, in our conversation today in terms of identifying those issues that we as a committee, a group, a section wish to tackle. Now, before we get into that conversation, let me share with you some of the issues that the other groups have identified. And the reason I say that is because over the last couple of days, there have been a lot of similarities in many of the issues that have been identified here. And we may find, though, that in the data and technology group that we want to focus on a variety of other things, but this just gives you a flavor of some of the issues that the other groups are looking at. So for instance, family services, their issues are first and foremost staff recruitment and retention. That's one of their primary issues. They're concerned about how the impending vaccine mandate will impact that in terms of their staffing. They continue to be concerned about the pay for family service related employees. There's a desire for increased professional development, specifically around family services, but really focused on mental health and burnout, employee morale, things of that nature. And then sort of an overarching theme that we got from the family services folks was sort of integrating family services and family engagement across the Head Start program. So instead of everyone living in their silos, I think as we sort of traditionally see, it really was trying to get everyone to think about family services, everyone sort of be on that team regardless of their role. The health and nutrition group, again, we see a lot of the same things. Recruitment and retention of staff continues to be a primary issue for them. We focused a lot on nutrition. There seemed to be a recognition and agreement amongst the group that there's an awful lot of training and professional development out there when it comes to health related, sort of traditional health related issues, but not a lot out there when it comes to nutrition and food training. And so they really want to pursue that. They're looking for some mentor roles. They're looking for folks to mentor new people that are coming into those health and nutrition roles, looking to eliminate redundancies. And then when it comes to trainings, they're really focused on behavioral issues. And then finally, when we get to disabilities and mental health, again, very similar issues. Staffing shortages, recruitment and retention continue to be an issue. Technology challenges. They really focused on the difficulties that sometimes exist when working with parents and families, whether it's working with them remotely or getting them to fill out applications, getting them to go to different sites to access information. They're interested in continuing our compensation and benefit study that we've just relaunched, and then really zeroing in on teaching conscious discipline sort of across the board. So those are sort of a little bit of a flavor of what some of the other groups have been discussing. I think this group may be a little bit different. And that being said, I want to turn to Stacy and to Trish to talk a little bit about, oh, Stacy's kind of you got your hand up?
Yes. Is it possible for us to get like a summary of what you just?
Oh, absolutely. Yeah, I'm writing. I'm writing.
There are
this all
things
happens
that you.
quick this week. I've got all the notes right here, but I'm writing up a summary for each one of those groups.
Okay,
Sort of
there are just
outlining.
things that you said that does seem pertinent to this group, or the things that Trish and I continue to talk about just with our programs. And so I think it would tick some boxes also for other people in this group.
Yeah, and I think there will be some overlaps.
Oh, for sure.
As we're starting to see, as the groups are talking and identifying sort of their issues and objectives, we're seeing an awful lot of crossover. So I think there will be some activities back and forth between the different groups. So with that, I think it's been what, 6 weeks ago, maybe something like that. We had a really good conversation with Stacy, Trish, and myself, just sort of about this group and where we want to go and what we want to do. So I'm going to kick it over to Stacy and Trish to sort of begin the conversations about some of the issues that this group might want to be considering.
So a couple of things that Trish and I have experienced these past few weeks has been a little bit harder on us. So we had texted back and forth for the past several weeks, but we just now were able to talk and just fine tune some of the things that we had discussed over text messages. So a couple of things that we are both very data driven. Trish's background with what she talked about, all of the areas that she's been exposed to in Head Start, and then a lot of stuff that I've been able to be a part of. We have a good understanding of programmatic data, regardless of where we are in our positions right now. So we kind of wanted to know, really, from your perspective, what you felt like with your programmatic data. So we had 2 questions that we wanted to ask. We can answer one and then answer the other one, but basically it's what is your perspective of your program data collection? So just be honest. Our assistant director isn't a part of this, but I would have had the same answer. And then, does your program face challenges with data collection? So I don't mind to answer first. I'll let Trish answer next, just so that you can see that we do want to be honest with this answer. Our data collection, I feel like that we haven't streamlined a lot of what we could do as a program. We are ultimately a new data team. So as far as data collection, we do the data collection. It's data presentation. Like, how does data tell a story in your program? And I think that's where I think that's our challenges with our data collection. But as far as what we collect, we are collecting a lot. And we as a program truly justify, is it something we should collect, or are we collecting it because we just feel like we want it, later? And so I think that is something that as a program we do well, that if someone has a new idea to collect the data, like recruitment would be something. I know that that's important to know that information, but we really sit down as a group as to why we would want that information when we started asking it several years ago, and just, combing through those questions. Maybe recruitment's a bad example, but it's anything that comes up. That would be how we would look at that as a program, and we poke holes all through it. And then sometimes we walk away and say we don't need it. Sometimes we say we should have been collecting that 5 years ago. And so I think that that's what we struggle with as a new data team, is just streamlining those processes to across our content areas. Trish?
Thank you. That was very good. I think that with Murray Head Start, we're very similar. It's kind of like silos. We have the education team, we have the family service team, and we collect data very well. We have a lot of data collection. We collect it well. Sometimes I think we do collect data because that's what we've always done, certain parts of data, and maybe we need to focus on other areas. But we do collect data well. It's just not always shared as well as maybe as it should be, like the presentation. And even within our agency, the family service team may not know what the education team is doing as well as I think they should, because we are a team as a whole, and we need to communicate well and be able to verbalize what we think the other people are doing. But I think the visualization of our data is one of the places that we are the weakest. Cindy and I have just completed the National Head Start data certification. And that was one of the things that we looked at and we worked on. And then also setting up how we do collect our data in a database so that everybody, if something were to happen to any member of our team, someone else could come in and collect the data in the same way. And I just feel like that's something still in progress and we're working on. And we've got a long way to go, but we're getting there. But like Stacy, we just need to streamline our data, how it's collected, how it's presented. So there you go. Next.
Who wants to go next?
I'll go next. As I said earlier, I'm the director of analysis for the Greater Louisville Head Start. Although our grantee is new, my experience has been vast in the data and record keeping. In regards to data, I have to say, we've been very consistent in record keeping. In TS Code, we have our record keeping system called Insight. And as many have shared already, it's how it's presented. And actually, we did a little deeper dive, and some of us in the team have a programming background. So we have a lot of new dashboards that is very user-friendly and real time now. So it's not just generate a report and kind of dissect it. Now it's like, oh, this is a nice little chart and a circle and all this, and it's very somewhat interactive. So we've been doing that in a couple of ways. We've been using Google, and then we also been using Microsoft BI. So we kind of have both fronts of visualizations. It's actually been helpful, but it also depends on how the team uses it. So we've been using it proactively in our meetings. So it's been kind of like our core when it comes to reporting. Reporting is very important. We weekly, daily basis on some key items. So we try to keep it fresh. And also in regards to staffing, we've been using, Google Classroom. So we have short bit tutorials on how to do things. So everybody's getting the same message across the board. Even if something's new, saying, hey, you know what, this is how we've seen, we noticed this error on a report, but this is how it needs to be corrected. So we kind of do it a two-way. We do the little video. We also do a little resource page and show them like step-by-step because we want to make sure everybody's kind of consistently on the same page. So, and as I said, the team is relatively young, but I have to say that even within last PIR, we were on it like right from the beginning. We really didn't have many errors off the bat. Data was consistently collected. In regards to TS Code, information is, just trying to get that reliability, and the coaches do a great job to ensure that, when they're scoring kind of consistent. But, with the mandates and all that, we just don't know what's going to happen. A lot of people are threatening they're going to leave and all that, but, those are variables out of our control. So the things that we have had under our control, we are trying to do it consistently. So with the consistent message, with the training, the reporting. So I have to say, we are also very data driven. Our meetings start with reporting. It ends with what's our next step. We try to forecast what might be our next big item. So we either use either a Google product or Microsoft product to collect that information. But more importantly, we also have the reporting after it's done. So,
David, how large is your program?
We are 552 children. Unfortunately, we're not fully enrolled.
Is that Head Start or Early Head Start?
Both, okay. Pretty much cut in half. But my experience also is from Indiana. I was part of the largest Head Start grantee in the state, and which we had close to 2,000. So monitoring, which is also the second thing. You could collect, but if you're not monitoring for consistency or the data entry of it, then you're just collecting junk. So we are consistently monitoring whatever it's needed, like a report, if it's the forms or the forms matching the thing. So as we're monitoring, those forms are going into our database, and we see visualization saying, this staff might be having an issue learning this. So it's geared to professional development as well. So so that to answer your question, we're just less than 600, but we have a vast network behind us as well.
Fantastic.
I do
Martina? Oh,
I
sorry.
do have one other question. Do you use Child Plus?
No, we actually, like I mentioned earlier,
Created your own.
we're a part of a bigger network. We're part of the Shine Early Learning team. That's I'm not sure if you guys all heard, but it's pretty much a TNTA network that's across the United States. We have grantees in Nevada, New York, New Jersey, New York. So Shine pretty much has their own record keeping system. So it's called Shine Insight.
Okay.
Fantastic. Martina?
Yeah, I'm just curious to know if your data team consists of individuals who only focus on data, or are they members of your management team, content area management?
So we have 7 individuals that are part of the team, maybe just 6. We have our assistant director, which he was our program operation manager, but he was promoted to assistant director, which is a new position in our program. We have now our new programs office operations manager, which she was already a part of the team, but now she's in just this new role. And then we have 3. We have myself that does education. We have one that does family services, and we have one that does health. So a part of that includes nutrition as well. And then we have the one that supports Child Plus, and that is the only database that she supports, but she's also deals with our policy council. So that is also included in our team. And we may have one other person that I feel like that we're going to add, and she's the new administrative office manager, which she handles the staffing paperwork. So we're pretty diverse. And then I used to be the Child Plus administrator. So, and I still support that in some capacity because I'm still here. I didn't leave the program. So there's just things that I still do, but I like it. I don't, but I was just, education was a piece I didn't know.
Okay, the reason why I ask is because I guess we are set up a little bit different in our organization. So our data analysis team is our management team. So they are overseeing specific content areas. So we have 10 individuals, and that does include the assistant director, myself, my administrative assistant, as well as the content area managers. And so when we are looking at data, we have those people who have the experience and expertise in their specific component areas. And they're the ones that's bringing the data reports in for us to analyze and so forth. Some of us also just completed the data literacy credential last year through the National Head Start Association.
Did you like that program?
I'm sorry?
Did you like that program?
I really enjoyed that program.
I was going to ask Trish, but
yes. And we had actually made a lot of changes internally when we're looking at data, because as you all have indicated prior to that, we were bringing in so many different pieces of data. And I kept saying, well, what does this mean for us? How are we going to use this data? Is it important for us to collect this? And so after taking that data literacy credential, we started honing down into our story. What do we want to tell the Office of Head Start? And so we did start looking at data much differently. We revised our reports that we are sending out to our policy council, our board of directors, and to the Office of Head Start. But we did start breaking our data down in a different capacity. And so the initial data literacy team that received their credentials, it was the education team and myself. And right now I have our family service team, our nutrition team, our health team. I have different people. So in the end, I am putting every manager that looks at data through that credentialing process, because it does change your mindset on how to look at data.
Oh, fantastic. That's good to know.
Yeah. So, that's kind of the way that we're designed and what we're looking at. Like I said, we've already implemented many changes within our program as far as analysis and reporting. And so I was interested in being on this team just to kind of see what other people were doing, if they had, different strategies or ideas that maybe I could take into consideration and implement into my own agency. So that's kind of where I stand on it.
Our program has a management team, which there is about 8 of them on there, and Brad and Shelley, which is the assistant director and our programs operations manager, are a part of the executive team. So it's their responsibility to connect the two teams. And then when we do self-assessment, all of us are in the same room. So what, 14, 15 people are in the same room. And so we utilize that 2 or 3 times a year for all of us to come together with a data set, especially if there's a data concern. We bring the executive team in, which is our upper management. So it's just, we're funneling data to them where we've talked about it in our data team. It's what the purpose of the data team is to, we should have finalized steps so that when they start, combing through the data, it should be quality data at that point. Once we talk about it with our data team, that's just the way that we looked at it. So.
Right. And I could tell you it did help us as far as the data literacy credential goes,
Yeah.
because we made so many changes. We completed our FA2 review last year.
Oh,
And
yeah.
so instead of giving them a bunch of different pieces of data that means something, but what does it really mean for your organization? What story are you trying to put out there to the team members? And so we were able to give them smaller increments of data and use that toward our program goals, the progress that we were making toward our program goals. And I received nothing but positive feedback from the federal review team. So I think it is
good news
helpful.
to hear that. Yeah. Okay. John, I don't know. That is not something that our program has explored, is that data literacy credential. But I do think that that's something that, all programs should be exploring after talking with Trish and Martina. So.
Yep, I've got a note here on it.
Justin, you're next.
So I resonate with Martina. Our data tracking, it follows the same model. Our management team tracks data for each component area. We use a vast array of data tracking. We use DataSay. We use Child Plus. We use Teaching Strategies. We use Ready Rosie. We use Hatch. And then we're finding new areas of data to track that we never even thought about tracking before. For example, Stacy, when you mentioned recruitment, we have started tracking employment, our efforts for employment and staffing, like how many applications we received, how many interviews we conducted, how many staff declined a position, why they declined a position, what credentials did they have when we interviewed them. And we're also tracking a lot of our COVID information still, because that continues to be a big factor. So we are constantly tracking how many COVID cases we have in each center, in each classroom, how many centers were quarantined, things like that. And I'm always anxious and just eager to learn of other ways that programs are tracking this data or making it more simplified, moving data to one place instead of 6 or 7. We've tried to put more data in Child Plus and more data in DataSay and take it from other areas so that we can find everything we need in one place. And
that's what our assistant director would like too.
Yeah.
I think
So
most
that's-
programs would like that.
Yes, for sure. But that's kind of where we are.
Okay. Well, I think that's very helpful, because I think we're pretty much on the same page as far as where our focus is. Wes, would you like to go next? Do you remember the questions? Wes? Okay, Aaron, I'll let you go last since you came in, and I'll let Ms. Spillman go next. But what we are talking about is we had just a couple of questions to see where everyone were with their data collection. So your perspective of program data collection, and then does your program face any challenges with data collection? So Aaron, I'll let someone go in front of you. so that you can hear their full answer.
They're so used to working
Um,
with me. I was trying
We
to
use
review.
Child Plus,
Right,
Teaching
to
Strategies
get to start with
Gold,
it. You know
and
what I'm
Learning
saying? That's
GB
why I
to
did
collect
my
data. I thought it was interesting what Justin was saying about tracking data for employment retention. We do not currently do that. I know the district just recently changed their system that they use for getting employment applications, and I know that the superintendent does exit interviews. So I think that would be really interesting to start tracking that kind of data. We do really well with enrollment data, demographics, things like that. We can do better on family services and things like that. We've recently had some structural changes with our family service team, and I think that has been part of the challenge in needing to be consistent with the data collection and Child Plus. We all wear quite a few hats here, so I think that monitoring is a piece that we could improve in as well, just because everybody has a lot of different jobs to do. TS Gold, this is only our second year for using that, so teachers are really still in the learning process for that.
Okay, thank you. Aaron? Hello.
Hi, how are you all?
Good, how are
Yeah,
you?
good. Yeah, we use Child Plus and Teaching Strategies Gold. I don't know if I'm the best person to respond on how how well we use that. I really don't have any direct involvement with either one of those, but I do know that's what we use. We don't use anything to track like employee retention and that kind of thing. So I thought that was interesting what I did hear.
Aaron, what is your position?
So I'm the director of technology here,
Okay.
but I do a lot more of like desktop support and like a lot of, I support all of our programs, but some of our other management staff in Head Start would know, would be able to address like I'm looking at this survey here and these type of questions about like what we struggle with as far as data collection. I wouldn't know really what to respond with there, but
Okay.
I do know what we use. And as far as we've used Child Plus for a long time, I think in that regard, most of our staff are happy with it. But
Well, thank you for your feedback.
What
Yeah.
program are you with, Aaron?
do what?
What program are you with?
We mean what program?
Head
I'm
Start program.
Like
Yeah.
I'm with Murray Head Start.
yeah, I'm with Community Action of Southern Kentucky.
Okay, thank you.
Yeah. I wasn't sure what you're asking me there, but
Yeah.
yeah, I know we use Teaching Strategies Gold. We've set up some tablets and used that, but I don't have any direct experience with it.
Okay, thank you. Wes, are you back with us? Okay, if he pops on, then we'll ask him. When Trish and I did this committee before, we were going down the path of finding out that the people that were part of the group before didn't have really set data collection systems in place. They had databases they were entering in, but they didn't have set data collection or presentation really. And so we had, and it was never presented, and I don't feel like, unless Trish and John disagrees or agrees, but I don't feel like that this group needs that, because I feel like that the presentation of data is established in the programs that we are, a part of today. So that was something that when we were talking about the different data collections, we found out that most people were using Child Plus, which seems to be the consensus, besides maybe David's program. And we are equipped to understand that other programs, the outcome would still be the same. We still have to, report out the program information report, the PIR. We still have federal reporting that we're required to do. We have state reporting that we are required to do. So, I mean, we handle that very universal when we talk about the data set. A couple of things that we were, hopefully to get through, and I don't know, and unless John has a quick way to conduct it, to kind of come up with a couple of strategic goals for our group. I feel like that we have a lot of information that was said, that the goals are just already written. We just need to come up with a consensus of really the strategic goals of what we want to work on for the next year as part of this data group. John, what do you feel? Trish, how do you feel about that?
John, how do you feel?
Looking through the things that we have discussed thus far, and of course, the conversation that we had before, the one thing I do want to make sure that we do, and I think this might have been reflected possibly in Aaron's response, is I think that I don't want to get lost in a data versus technology. I think we need to sort of have both of those conversations within the group. I think it's very easy for us to really focus on data and data collection and dissemination and analysis and how it's being input and how it's being taken out of the system. One of the conversations that we had originally was not necessarily figuring out how we streamline everyone to either have the same system or collect the same data. It was to really figure out, what do we already have and how can we extract that information from our programs in a way that it is similar enough for comparison. That was one of the things we talked about. I think the flip side of that, though, and this sort of gets towards Aaron's comment, is we do need to focus on technology. And I think technology is a distinct conversation that is separate and apart from data. Because when we're thinking about technology, we're thinking about ways that we're interacting with families and students virtually. We're talking about the tools. We're talking about internet access. We're talking about the ways that our staff are using technology. And so there's a whole other realm there, even though we focus this conversation thus far on data, which is great. I want to make sure that we also focus on that other technology question.
For sure.
And I think that, I don't know about y'all, but in our area, access to internet is still an issue. And we won't use Child Plus Mobile at this point, because we would be asking a lot of our staff to use their own data plan, because I mean, there isn't always internet access available in even all of our centers. So, wireless. So I think that that's something we need to think about also. And when you talk about technology, we used Google a lot during the pandemic to collect some data from families. Like we put all of our applications, even though Child Plus has applications in their program, it didn't work well for ours because we have 11 districts and the parents would have to choose what district. And if it was the same county, they might not choose the right place. So to eliminate that, we created a Google form for each of our pieces of application, and it will actually transcribe onto a piece of paper that looks like our application. And then they could also have a spreadsheet to disseminate the data. But that's a different type of technology that we're using. So I agree with you, John.
Yeah, and that was one of the big challenges. I think that at least I think it might have been the health and nutrition group yesterday really identified that as a barrier, oftentimes to working with parents and families, was just the ability to get them to use some of the technology. And they even referenced the fact that oftentimes you're trying to teach parents how to do it when in fact you've got staff that don't know how to do it. And sometimes you've got staff who are the ones who are doing the teaching who don't necessarily know how to do it. So there's that aspect to it as well. But Stacy, to your point, I think that the issues are there. And I think that of all the groups, this one pretty much writes itself. I think people really know what those 2, 3, 4 major issues are, but I think there will be some that pop up as we go. That being said, we can't tackle everything at once. We don't want to be a mile wide and an inch deep. We really want to focus on some things where we feel that either as a working group or as an association that we could actually make an impact in an area. We can actually affect some change or learning or progress there. And just because we don't focus on an issue right now doesn't mean that it's not important. It just means that we're going to get to it next.
Absolutely. I think that one of the things on, I need to add it to some of our agenda stuff, is that NHSA, the data literacy credential. Brad had just spoke to me about that. I had not honestly seen any paperwork or communication about that until Brad and I talked about it last week or 2 weeks ago at the scramble, the Child Plus scramble. So something that I think that programs have benefited from, and excited to hear that Martina was able to present, more quality data in, a lesser volume, which is exactly how you want to present your data. If you can tell the whole story in one simple presentation rather than having to have 3 or 4 pages with narratives, that's definitely what you want to do. So, sorry.
Yeah, that sort of raises an interesting question. We are so diverse as a state in terms of the grantees that we have. We have 28 grantees sort of spread all across the state. Some of them large, some of them small, some of them urban, some of them rural. And I would be really curious to sort of see how they're sharing that data, how they're generating that data. Martina referenced the data literacy and how that has had an impact on her program. I'd be curious as to how everyone is doing that. That may be something that we as a group want to just sort of collect, just sort of figure out where are we.
Yeah.
Just to sort of understand what's that jumping off point. And that may be true on a variety of issues when it comes to data and technology.
So I guess one of the strategic goals, and I'm just kind of reaching here, but one of the strategic goals would be is to identify some data set or pieces of data for us to look at across our programs.
Are you saying like more like an inventory?
No,
How
I
many
think,
people are using Child Plus? How many are using TS Gold? How many people
well,
have?
we did do that before. I think that is definitely a baseline, but really the data we are required to report federally. We know we have to have that information available if a review team comes or if it's federal reporting where we're reporting that data out. We know we have to have that. So like even in yours, David, in your program, you're not using Child Plus, but you're using a product that is a child tracking system. So you're still getting quality data based on your all's monitoring efforts. So I think that it's difficult. We know what the data has to collect, but what pieces can we identify so that we can start as a state, start looking at this. Kentucky Stats is we have that program, Trish and I are part of that as well, to where we are not streamlined. We cannot streamline that data set either. So we're a part of that as well. So that's just something that we know the data is available. We just need to show them how to extract it out of our system. So.
Yeah. Do you think it would be useful going forward to have a representative from KY Stats with us?
I think that if as we get up and going, I definitely think that would be helpful, because then they can at least hear and then we would know what they're trying to represent of the state, because they're trying to streamline it across all grade levels. They're trying to take a child from, prenatal if they can, all the way to high school, and then even past high school. I've seen that take that information, as long as they're enrolled in a Kentucky college, they can see that as well, K through 12. It's just what they're having trouble is connecting our children to that system. So that's what they've been trying to streamline.
And
Yeah.
a lot of that goes back to the fact that the state of Kentucky has a collection system. And so everybody is the same, where with the preschool, the Head Start and preschool, not everyone is the same, and they don't understand Child Plus.
Right. And most of the state uses Child Plus. When we did this before, there was only one program that we had that used COPA, which is Child Outcome. I don't remember what the P stand for, assessment. But that actually was a program that we used before. So I was familiar with it and the outcome of that data. So. And then using, you said that you all are using Google, you're using Power BI. I use Power BI. I don't use Google much, but I use Excel with the Power Query, which is the same Power Query that's in a part of Power BI. It's just, I have found that staff like list, and I can do that better in Excel to print out those little lists for them as to what's missing. And so I use the Power Query inside of Excel for the list, and then the analysis is done in Power BI. But I am very much intro into Power BI, and I think that's a free tool, or at least that's the version that I use, because we're not using it as dashboards yet. But I think tutorials of that, it sounds like your program, David, is really using that system. That would be helpful as well.
I think so.
Mhm. It's really knowing the output of the data, what we're using too. That's always helpful as well. Do you all have any things that you're interested in, working towards?
I kind of agree with what John was saying earlier. It's just trying to find some data points that we all have in common, even self-assessment, a common data points for self-assessment, so that we can see across the board in the state where we fare. We all part of the monitoring system one way or another, but if we could kind of see them in different perspective, it gives us a better understanding of maybe our program fares at a state level.
What about the community assessment as well? Is that something? We have one individual that does that now, but they're trying to get more of us involved in that process. Is that something as well? That would be an overarching thing that we would all be required to do as well.
I think that's a good idea, because we are trying to revamp our community assessment.
We're just updating ours, but I was just trying to think in regards to something that we all have to do. Our 4 years might be different, but every year we need to kind of update. But what item that we could all share in common within the community assessment that we could all ask? So
yeah, I think that's like narrow it down instead of the whole. Yes. And then the PIR, that would be, I think, another piece of data set. But like you said, David, it would be something else that we would have to just definitely take in chunks to look at and compare. We have a lot of issues. We're mainly in Western Kentucky with resources for medical providers. And I would say that that's probably consistent in most of our Head Start programs, maybe not in some of the Louisville, Lexington area, but in the rural communities that we're in, we really struggle. We only have 2 or 3 communities that just have an abundance of resources. Or 2 or 3 counties, sorry, that really have an abundance of resources for medical providers.
Or dental.
And dental as well. Dental that takes a medical card is what we have. We have a lot of dental providers, but they don't take medical card. So that's what we have. So we use UK Dental. Which is obviously based out of UK, and they come and they do the exams inside of the classrooms. And so the issue, and it's it's a very small issue in my opinion, but it is an issue, is that some of the dental providers in that community specifically in the county that I live in, Davis County, they don't want UK dentals in there. So we're like, okay, if you don't want UK dentals in our classrooms, then you have to come out. And so now they come out and do the exams themselves. And we had it in another county that was very rural, and they just threw their hands up and basically said, okay, you can bring them in, because the volume of kids in that county was just too many for them to manage, and they could not get the dentals done within 90 days.
How about something that Aaron kind of mentioned about, it's just infrastructure. I'm kind of shocked to hear about maybe some classrooms don't even have internet, so just that type of assessment of saying.
Our classrooms do have internet, just not wireless.
Okay, but something even like that, I know that during the pandemic, I live in Meade County, even though I work in Jefferson, that's pretty rural too. If it wasn't for our public library and their hotspots, a lot of kids wouldn't have internet. So that type of being able to be a resource within the community of, being a hotspot for the community, but even for our children, if we had to go into extreme measures again, that type of assessment saying, when we talk about being mobile, what do you mean by being mobile? Are you just talking about laptops? Are you talking about iPads or anything else? Are you talking about even itself? We have a home-based program, and we offer Chromebooks with Wi-Fi, so does that mean every program had that type of thing? But, just kind of assessing.
We had buses that had Wi-Fi that would set up in certain parking lots around the county.
And so we wouldn't have done that. We don't have transportation, but
and that was interesting to me that they were able to do that. But we had several of our counties, not all of them. We're in 16 counties in Western Kentucky, but
yes,
we had several counties that were able to utilize the buses for the Wi-Fi, and parents knew the locations. They used Facebook and other, probably One Call or whatever mass distribution that they were using to communicate with parents. And that's what how we were doing that for, our children that needed that. But I think that's because we have a few counties that it is difficult to utilize any type of technology, and a lot of times they're down. So we have to be prepared and to help them. So I see the time is 9:58. So John, did you want to close, or do you want us to close? Or I think the conversations were fantastic. I think that we all are in similar situations with our rural communities, and I think that we all have the same challenges. I think the next thing is really to identify pieces that we can look at in small doses, because we're only have an hour. So I think that if we really dissect the data and look at each grantee, I think that you could almost use an hour for, the opioid or whatever, if we choose that on the community assessment. So.
Yep, I've got 4 pages of notes here from our conversation today that I'm going to use to create sort of a summary, and then to outline, based on our conversation today, what I think are emerging as some of those potential goals and topics for us to focus on. And so what I'm going to do then is share that summary back out with you guys, sort of with that broken down, and we can sort of go from there in terms of picking and choosing, sort of looking at our list. Like I had said at the outset, just because it's on the list, but we're not focused on it right now, doesn't mean we won't focus on it. We're just going to have to take things in chunks. I know that our conversation today was just for an hour, but if we find that our future conversations need to last longer, we can certainly schedule them that way. Right now, we've got 17 of our grantees have made appointments to the sections. So I'm still working on the other 11. So I would expect that we will have more people participating. You've got a copy in that Google Drive folder. You've got a copy of, let me find it here. You've got a copy of the roster of this particular group. So I would encourage you to take a look at that. It outlines not only who folks are, who they're with, but most importantly, how you get in touch with them and what their roles are. So what's really happening as an added benefit to each of these sections is we're really creating, I think, a solid directory of the different folks in the different areas across the state that we're then able to share out. So what I'm going to do, like I said, I'll put together a summary, get that out to everyone, and then we can make some decisions as to what we think those goals and objectives ought to be based on today's talk. And then we can decide when we would like to come together again, and if there's anybody else we'd like to invite to participate. So again, this will be a very organic process. My goal right now is for these groups to come together 4 or 5 times a year to have these conversations, but we may very well find that as we dive down, we might want to come together more often, or there might be select groups of folks that want to come together and work on things.
John, depending on the data set that we choose, like, let's just say next time we talk about self-assessment as an example, I don't fully manage the self-assessment. I know the part that I know. Can I bring on the one that compiles all of that?
Oh, absolutely. Yeah,
Okay.
I think the more the merrier.
Yeah, I just feel like that, if we talk about family services, I would want that person there, but it may not be necessary to have everyone on at the same time. So just depending on the topic. So just be mindful of that we're very flexible when it comes to that. If you want to add individuals based on the topic, and we should know the topic, in advance always, because we hope to prepare, for the meeting with data and stuff. So.
Okay, any other questions or thoughts before we break? All right, thank you.
I'd like to thank everybody for their time and for their interest.
Yes.
Yeah, very much so, very much so. So I will get this out and we can then go from there. So I appreciate everyone making time to join us this morning, and we will be back together soon.
Thank you so much, John.
Thanks,
Thank
everyone.
you, John.
Thank you all.
Y'all have a great day and a great weekend coming up.
You too.